Hey, welcome back to my channel. This is part 2 of my breast reduction story. I had my pre-op appointment today, this afternoon. I met with my plastic surgeon and I went in with a really long list of questions since I found out that I was absolutely having the surgery, so my questions got a lot longer. I took in a sports bra that I had bought right after I was approved just to make sure that my plastic surgeon thought it was a good bra to use post-surgery. I don't use a bra, like she doesn't have me leave the hospital in a bra. I leave surgery wrapped in very tight ACE bandages, and I'll move into the sports bra after that. But I just wanted to check with her to make sure that the sports bra that I got was going to work for me, the size and everything. I'll show that to you right now. Just got just regular sports bra, zip up front, nice back. I'm not used to wearing sports bras like that. It does have foam like cups in it. She said to keep these in. That will help with shaping afterwards. It is lined on the inside, which I thought was really nice, so it's not going to irritate my incisions, hopefully. She said this was great. That'll work perfect. I got two of them for less than $15 on Amazon, which you ladies that have larger breasts know how expensive bras can be. So to buy two of these sports bras for less than $15 was amazing for me. And I'm very much looking forward to not having to spend $60, $70, $80 on one bra from now on. So I went in with this list of questions. If you see me looking over, I've got the list of questions here. I'm just going to go over some of them with you, let her know what she told me. Now, for some of these things, your plastic surgeon might do things a little differently than mine does. For instance, my plastic surgeon does not use drains. Yours might. Things like that. There's just some things that, it's not set in stone what is done. So my surgery will be performed at the hospital that she works at. The hospital that she works at is very large, so her office is in a different building on the same campus. So I'm going to be going into the main hospital to have my surgery done. My surgery is first of the day on January 3rd, so I have to be at the hospital at 6 a.m. I live an hour away, which means that I have to leave the house a little bit before 5. I have to get up and shower at probably 4. It's going to be a very long day. So with mine, I do not stay overnight with this. I know a lot of plastic surgeons, you go home immediately, like mine. I will have the surgery. I'll go into recovery. Once I'm doing good, then I get sent home. Some will have you stay overnight, or if there's any complication, I would have to stay overnight. But as of right now, it's outpatient. My pain meds and my nausea meds will be given to me at the hospital, so I don't have to worry about dealing with the pharmacy or anything. I just get it when I leave. She did tell me to go ahead and pick up a stool softener such as Colace or Miralax, something of that nature, to help afterwards. And believe me, I've had 2 C-sections. I know how important that is after your surgery. I asked her about my medications. I am on quite a few heart medications, and I also do take birth control. Heart medication, she said I can keep taking that. That's fine. I can even take it morning of with just a little sip of water. Birth control, she told me to stop taking the birth control right now and not to start it again until after the surgery, because the birth control could cause blood clots during surgery. So I will be stopping that immediately. I asked her about revisions. If they are needed, would my insurance cover it? And she said, insurance will cover some of them, I guess if it was something really major. Excuse me. But she said if they're simple things, then she covers that. She does that herself, free of charge. Excuse me. In her office. So if I got dog ears or something, she would take care of that free of charge. So that's great. I asked her about anything for the nerves day of surgery, because I know myself, I know I'm going to freak out morning of. I will be fine leading up to it. I'm just excited right now. Morning of, I will be a basket case. So she said, yes, I will get something when I get there. The anesthesiologist will give me something for my nerves to calm me down. I asked her what she recommended for scarring, and there is something that she prescribes. She said it was a compound cream that gets made somewhere in Florida. She highly recommends it. She prescribes it. She says that some insurance covers it, some doesn't, so we're not sure right now if that's going to cover it. She told me if not, then vitamin E worked really good. So if you're looking for something about your scarring, she said vitamin E is great. I asked her about ice for swelling and pain. I know some doctors say it's fine, some don't. She does not. She does not go with ice at all. She said where I'll be numb, and if I try to ice myself, I could end up hurting myself because I wouldn't realize that I had it on there too long. I asked her if she thought that I would have to have an FNG, which is a free nipple graft. She said she does not believe that she's going to have to do that. I think she's dealt with the breast reductions enough. Maybe she's got a better technique. I don't know. She does not believe she's going to have to do that with me, even though I am going from a very large size down to, much smaller size. So that's good. But I told her if it's something that is needed, then go ahead. I just want to be smaller. I asked her about my post-op appointment. She said all that gets taken care of like day after. They call me and they set something up for like a week later, things like that, which is good because I was not looking forward to getting back in the car the day after my surgery and going another hour up and another hour back. So that's good. I asked her about liposuction on the sides. A lot of people get it done. I think a lot of times it's thrown in there just normally. Like it's common to just, the doctor just does that to make it, from what I've read, to make it aesthetically pleasing. I asked her about that. She doesn't even think that I would need that because I don't have a lot of, like, right here, I don't have a lot of extra fat or anything. It's just nothing. So she doesn't even think that was something I was going to need. My insurance didn't cover it, so I'm really glad that's something she didn't think I would need. I also asked her about wound care at home. What would I need? She said I really wouldn't need anything. She said I go home with some kind of tape that stays on there for 2 weeks. After that, I should be good. I've bought some things like to deal with if I have any like seepage or anything from the incisions. I've got that. My husband works at the hospital, so he's very comfortable with wound care. He's actually kind of looking forward to that part of this. I was given my list of do's and don'ts for the day of surgery. I have to have blood work and a pregnancy test done 6 days before the surgery. So hopefully 6 days before the surgery hits right around New Year's. So I'm hoping that that doesn't cause any kind of problems. Some things didn't apply to me. There's a bunch of medicines. If you're taking them, you're not supposed to take them before surgery. My heart medication isn't considered blood thinners, so I don't have to really worry about that. You're not supposed to take any blood thinners. Some of it's the norm. Nothing to eat or drink after midnight, except if I take the drink of water in the morning for my medicine. Need someone to drive me home. My husband's going to be with me. I have to shower the evening before and the morning of with my special little solution and everything. I don't know if you can see that. It's my Hibiclens. It's got sponges in here. There's instructions on exactly how you're supposed to wash yourself. What you wash first: neck, shoulders, torso, chest, arms. You have a certain order you're supposed to do it in. I'm supposed to use the entire bottle, half the bottle for the night before, half the bottle for day of. It also says on there, and this I found a little odd, I'm supposed to get in the shower, wash and everything. I do not use it on my face or my hair. I can use regular shampoo and regular soap on my face. I wash in the shower, rinse off, when I get out of the shower, I have to put more on, rub more all over me, and leave it on and let it dry, air dry, or pat myself dry, but not to rinse it off. I guess it leaves kind of a barrier. But I'll go by the letter, exactly what they say to do. So I've got my Hibiclens. Day of, I show up at 6 a.m. Surgery's at 7:30. Don't eat or drink anything after midnight. I feel like a gremlin. Don't drink alcohol for 48 hours before surgery. That hits right around New Year's Eve, stuff like that. I had planned on not drinking on New Year's Eve anyway. So, I'm not a smoker, but you're not supposed to smoke before or after the surgery. It can hurt your healing time. Don't take aspirin or aspirin products for like 5 days before. I can't wear any jewelry, any kind of hairpins, hair clips, makeup, lotions, deodorant, hairspray, perfume, anything like that. That's fine. I'm fine with that. You're supposed to wear comfortable, loose-fitting clothes the day of surgery. I'm planning on wearing my Christmas pajamas, actually. So it's, button up front, pull on pants. Sorry about that. My 2-year-old thought it would be a great idea to come and try to get a cameo in my video. Sorry about that. So yeah, I'm planning on wearing my Christmas pajamas. It's a button-up top. It's, slip-on pants. Very easy. Just said when I get there, I'll be taken into an area where I'll change. The nurse will come in, check my blood pressure, heart rate, temperature. They'll start the IV. My husband will be able to be with me during that time up until I go back for surgery. The anesthesiologist is going to come in, give me something to calm me, tell me how that whole process is going to go. They don't say on here how long the surgery is. I guess it varies. I've heard everything from, I was shocked, I heard 1 hour. Somebody had surgery in 1 hour. But I've heard as long as 5 hours, 6 hours. So I guess it just all depends. After surgery, I'll be taken to the recovery room. I'll be monitored. My husband will be able to be back with me then. When my blood pressure is stable, when I'm doing good, I've woke up from the anesthesia, all that stuff, then I'll be sent home. They will keep me if anything is wrong. I don't really foresee anything being wrong. I do pretty well during surgery. I've been put out a couple of times for surgeries. I do pretty well. Says, of course, expect to be drowsy the remainder of the day. Of course, they tell you not to do anything big, drive a car, sign legal documents, operate machinery, drink alcohol, things like that for at least 24 hours. Take it easy. Let my friends and family take care of me. No problem there. If I experience severe pain, heavy bleeding, or temperature greater than 101, I'm supposed to call immediately or go to the emergency room. And I did hear another story on here, a horror story, and that scares the life out of me. So yeah, I'm going to be watching my fever. If I get any kind of fever, I'm going to be watching that. And that's about it. I'll be getting the blood test next Friday, the blood work, the pregnancy test, and that has to get faxed, and I am good to go. So, little over 2 weeks, and I'll be going under the knife. I'm really excited about it. I hope to do a little bit of vlogging, either day of surgery, day after, things like that. I want to just keep vlogging this. So, thanks for watching, and I hope you'll come around for the next video. Bye.